May is Asian American and Pacific Islander Heritage Month, a time to really highlight and honor history, heritage, and the many contributions of the AAP community. It is also a time to acknowledge and understand struggles and challenges this community can face. So we're also talking about, in that scope of conversation, healthcare, right? Healthcare for the AAPI community. Joining me today is Dr. Ming Wu, family medicine physician with AdventHealth Littleton. Thanks for being here.
Of course, thank you for having me.
I know you treat all patients, but when we talk about communities within your patient population, what are some of the biggest, well, first of all, just the importance of understanding perhaps how different communities might be facing different disparities.
Sure,
right?
And yeah, it's very important because, you have to understand when someone comes in, I treat everyone the same as much as I can. However, language barriers play a huge role. And then beyond that, even cultural understanding of health and what that means for them, what that means for their families. And so really connecting with the patient is very important. And culturally, that's part of that connection.
How do you begin to try to bridge those gaps, that disparity, work with patients? And are there certain things that you're always kind of keeping an eye out for?
Sure. So one thing is always try to approach the patient where they come from, try to meet them where they're at. Sometimes that's, someone who understands exactly what their healthcare entails. And so you can, talk to them at a more higher level. Sometimes it's talking to them about basic screenings or even understanding, why eating the right foods is important. But understanding, what foods a culture wants, what they can do, what they spend their weekends on, what they do, on holidays. All of that can play a role. And so really understanding the whole patient and not just one aspect is an important part of just beginning to bridge that gap.
Let's talk about not just the body health, but mental health, right? Sure. In the AAPI community, what do you want to really focus on about mental health, overcoming any perhaps stigmas around mental health?
Yeah, so mental health is a huge component. If you look, traditionally, you will see that the AAPI community, they report less depression, less anxiety, all of that, and then less usage of psychiatry. However, if you dig deeper, about 60% of people that were, of adults, I think AAPI adults, when they were interviewed, actually have symptoms of depression or anxiety. But because they are either not aware or they are trying to downplay their symptoms, they don't seek care for that. And so they do suffer a lot, but they suffer in silence. And that's really sad.
It is really sad. And trying to, again, to your point, just address any kind of cultural differences about what do you do for yourself if you're struggling with something like that?
Right. Yeah, and then so, talking to them about, understanding, again, where they come from, what they understand about what does depression and anxiety mean? What does it do to them? How does it affect their life? And sometimes even just having a conversation about how are you feeling today? Or what are you doing now that maybe you were doing then, but you're not doing now? Understanding that this is all encompassing and impacts everything. So they might be sleeping more. They might not be doing things that they used to do. They might, they used to love gardening and now they sit around at home and they watch TV. Things like that can really signal. And so, talking to families about, hey, how's grandma behaving? How was she, what was she doing before? Was she not doing now? Those can all give you hints as to things that might occur. And, playing into the, families being so important with the AAPI community, maybe encouraging or helping family members look for what they might see in grandparents that could signal maybe they need extra help.
Incorporating the whole family into the medical conversation. Right. Well, and you are in family medicine, so you really are treating full family units here. Dr. Wu, thanks for coming in today to talk about this, and we'll continue to cover throughout the month of May, of course, various stories connected to the AAPI community.